All right. Well, October is Breast Cancer Awareness Month, as we mentioned, and 1 in 8 women will be diagnosed with breast cancer in their lifetime. Some shocking statistics, really. If you're just with your girlfriends, it could be just one of you.
Yes.
We have Dr. Ravi Patel with Comprehensive Blood and Cancer Center joining us tonight with more on breast cancer awareness, the latest treatments, some exciting things going on.
Yes, yes. Right. You know, one of the things is that everybody looks at that number. 1 out of 8 people are going to get breast cancer, and they get scared. But we have to also remember there are more people alive today who have had breast cancer and treatment, so no need to be discouraged. New treatments, newer discoveries are helping people live longer. Of course, the best thing is to change your lifestyle, right? Keeping your weight down, you know, that steak which you had in Dallas, you got to cool it off on that.
Dr. Patel, you always tell me limit red meat or eat grass-fed beef. I just spent a week in Texas and ate meat probably every day. I'm like, oh, you're going to be so mad at me.
Yes, we got to take a little bit less of that. Exercise regularly. Don't drink too much. More fruits, more veggies. There's hormone-free chicken available nowadays, so you can have that. So you can reduce your risk factors that way. Also, another important thing is it's okay to do breast self-exams even in young people. See, there's a
and that's why I want to ask, for women who are in their 20s, is it too young to start that?
I think it's a good idea to find out how your breasts are. And we see people, young girls in their early 20s, early 30s who have breast cancer. So if you notice a breast lump, show it to your primary care physician. The whole issue about not getting mammograms done at an early age is controversial, but if you notice something, it's a good idea to get the mammogram done.
And especially if you have a family history, right?
Particularly. That's a very, very important thing. Family history of breast or ovarian cancer can transmit the gene. Of course, Angelina Jolie made it very famous, but it's the BRCA1 and 2 gene. And you can literally change the destiny of your breast cancer by identifying the gene and taking the appropriate steps to prevent it.
Well, I'm glad you mentioned Angelina Jolie, because mastectomies, do your chances of survival, is it better?
So, very good question.
Because we're hearing more and more of celebrities coming out who are undergoing.
So, yes, if you have the BRCA1 and 2 gene, you want to get rid of all of the breast tissue. But if you don't have the BRCA1 and 2 gene, some people have a misconception that, you know, look, I just not got to get rid of all of the breast because my cancer won't come back. And sadly, that's not true if you don't have the BRCA1 and 2 gene. You can preserve your breasts. It's better to preserve your breast than go through, you know, a $5,000, $10,000 reconstruction if you don't need to remove your breast. So doing a lumpectomy can give equally good results as removing the whole breast. So it's important that you discuss this with your oncologist and have them coordinate and work up the breast cancer completely. We often see patients who have had surgery and have not been tested for BRCA1 and 2. So an oncologist can work to really identify what needs to be done before you make the major step.
Okay. Yeah, we're running out of time, but I want to get to these events because October is filled with tons of events.
Yes.
We'll talk about the first one is October 8th. It is the Kern County Cancer Run and Walk. And what I like about this, all the money raised stays in Kern County. So that's great. And I'll be out there. I think I'm emceeing it.
That's
which is good. I don't have to walk or run. But no. But Mammals and Manny's also October 15th, 8 a.m. to 6 p.m. It's $50 at CBCC. You get a pampering day.
Yeah, pampering day, a festive day, and get a mammogram.
And then, oh, I forgot to change this one. This is a free screening. It says Mammos and Manny's. That is not. It's October 23rd. It's a free screening, 12 to 4 at Lost Hills Elementary School. On all of those graphics, the phone number for CBCC up there for more information. We always have so much to talk about. I'm sure you'll be back this month to talk more about Breast Cancer Awareness Month. Dr. Patel, thank you so much.
Thank you. Thank you.
And we'll be right back.